Today I will take you into the world of bacteria. Bacteria are all around us. Most of them are very useful to us, but some cause diseases. And few of these disease-causing bacteria are actually one of the biggest killers in the world. In 1928, about a century back, Alexander Fleming discovered penicillin, an antibiotic that a fungus called Penicillium produces. Penicillin kills bacteria, and that changed the face of medicine. The first notable claim of penicillin was saving numerous lives of soldiers during World War II from war wound infections. Soon, antibiotics were hailed as miracle drugs. It didn't take long for these miracle drugs to become household names. Various different antibiotics were discovered and big industries started mass producing them. Young and old alike benefited from these antibiotics. Antibiotics aided in procedures like childbirth, surgeries, and even chemotherapies. But in the rush of antibiotics' success, we forgot what Fleming had warned us against. Fleming had warned that overuse and misuse of antibiotics eventually will render these same antibiotics ineffective. Let's unpack what he meant. In a bacterial population, there is natural diversity. While most bacteria die in presence of antibiotics, there are some naturally resistant to antibiotics. That means even in spite of having antibiotics around them, these bacteria survive very well. And their resistive powers lie in their DNA. Bacteria also have a very unique ability of sharing their DNA with other neighboring bacteria. What this does is that in presence of antibiotics, the few remaining resistant bacteria not only flourish, but they can transform the rest of the colony also into resistant ones. Scientists have reported such resistant bacteria against every single known antibiotic to us. And not only that, some of these bacteria are resistant to various different kinds of antibiotics. Such bacteria are called superbugs. Falling sick with a superbug infection is nightmarish because usual antibiotic treatments do not work on them. They ask for higher antibiotic doses or newer cocktails of antibiotics. Both of these are physically and financially draining for a patient. Those suffering from tuberculosis or chronic conditions like urinary tract infections routinely suffer through these. Yet, they do not have an option of new antibiotics because since the rise of superbugs, the pharma industry's interest in making new antibiotics has faded. They spend millions of dollars and requires decades of hard work to make a market-ready antibiotic, and bacteria soon become resistant to them. So in absence of other alternatives, patients, especially those with suppressed immunities, such as young children or elderlies or those having complicated health conditions like cancer, often do not have it in them to deal with superbug infections. Every single year across the globe, hundreds and thousands of people, rather millions of people, die of these infections. This crisis is called antimicrobial resistance or AMR. Those who do not die still suffer longer infections or lose livelihoods. Despite these staggering numbers, most of us do not know of AMR as a problem, right? And that is because our death certificates do not mention AMR as a cause of death. Our death certificates talk of immediate causes of death, such as organ failure, cardiac arrest. They do not talk about what caused these failures. Hence, it is now time to challenge the status quo because AMR not only risks humans, but every single living organism that uses antibiotics as its bacterial defense mechanism. We all living organisms require antibiotics to keep working for us. The good news is that AMR is reversible, provided we are willing to change our ways of working with antibiotics. How many of you in the room have taken antibiotics like azithromycin for regular colds and coughs? Probably a lot of you, right? And that's not surprising. However, did you know that most of the times colds and coughs are caused by viruses and not bacterial infections? Antibiotics are molecules that target only bacteria. The molecular architecture of bacteria and viruses are very, very different. What works against bacteria, the same antibiotics do not work against viruses. So while these antibiotics do absolutely nothing to stop a viral infection, what we end up doing is only increasing antibiotic load in the environment. Now let's say even if you are detected with a bacterial infection and the doctor prescribes you a 5 or 10 day antibiotic course, how many of you have stopped it midway as soon as you have started feeling better? Again, probably a lot of us do that. But we have to remember that antibiotics are not paracetamol-like drugs. These medicines require their course to be finished. A thumb rule of using antibiotics is to kill every bacteria that has been exposed to antibiotics, because any remaining surviving bacteria actually increases the risk of AMR. The third thing to remember is that the largest consumption of antibiotics actually happen on animal farms. Antibiotics fatten animals, they fetch more money, and hence farmers keep using them. Studies have shown that even up to 75 times more antibiotics are used on animal farms. All these habits need to change, but changing hard set habits require changes at individual as well as systemic levels. And these changes work only when they are done in the context of social realities. Now, the best way to avoid AMR is to avoid infections altogether. Simple public health measures like hygiene, especially the provision to wash hands with soap, good nutrition, vaccination, keep people safe from infections. Let's ensure these in our communities. When we fall sick with seasonal infections, almost for all of us, our immune systems are capable of taking care of it by itself, provided we take rest, good food, take lots of fluids, have a good sleep for a few days. However, we live in a society where good food and rest are a luxury. Most of us are actually in a rush to get back to work, and hence we pop in antibiotics when it is not essential. Can we build a society where we prioritize well-being before immediate productivity and sometimes simply attendance? Antibiotics are medicines that are supposed to be sold only with doctor's prescriptions. But again, in a country like India, where not everyone has access to healthcare or to a doctor, a lot of antibiotics are sold over the counter in pharmacies. On the other hand, we also have doctors who overprescribe antibiotics unnecessarily, or pharmacies who sell antibiotics because they fear that they will lose their customers through their other competitors. Let's build a society in a way where patients feel safe questioning doctors on the medicines that they are prescribed to, and train our doctors and pharmacists to become responsible healthcare professionals. This means training them to know how to use antibiotics judiciously. Doctors must prescribe them only when necessary, and doctors and pharmacists both must explain the patients how to correctly use antibiotics. That means finishing the course of antibiotics and not sharing it with families and friends. Government must also oversee the use of antibiotics. In the past few years, the Indian government and others have banned the use of colistin in animal feed. Colistin is a last resort antibiotic, one that we use when all other antibiotics fail. Similar strict regulations are important for the few new antibiotics that we have been able to discover in the past few years. Only with such strict regulations, we can hope that our new antibiotics remain working for us and bacteria do not become resistant to them very quickly. But at the same time, it is important to acknowledge that antimicrobial resistance is actually a product of natural evolution, and we will not be ever able to fully stop bacteria from evolving. Hence, it is important for us to think of other therapies such as bacteriophages. Bacteriophages are viruses that kill bacteria. Just like bacteria evolve, bacteriophages evolve too, and they open up a new way for us to think about medicine. Finally, let's understand that AMR is a wicked problem and requires all of us to come together. Irrespective of our status of a user of antibiotic or a prescriber of antibiotic or a seller of antibiotic, we all need to come together as responsible allies in understanding and learning that bacteria are constantly evolving and they will continue to do so. We cannot be at a constant war against them. Rather, we need to learn ways of coexisting with them viably. Thank you very much.